Welcome back. As the CDC reports high COVID-19 cases across the country, some experts are already thinking about how the fall and winter months could actually bring another wave of cases.
They are, and 11 Alive's Brittany Kleinpeter spoke to a doctor who says you need to get protected now.
For years, public health officials have struggled to nail down a pattern when it comes to COVID-19 surges. The virus hasn't typically followed a seasonal pattern like other viruses, such as the flu, which has created confusion over when to get vaccinated. However, health experts like Atlanta cardiologist Dr. Jayne Morgan says the time is now.
And remember, you can get the flu and the COVID vaccine at the same time in the same settings. We were hoping to have a combined vaccine by this fall, but that won't quite be ready.
Dr. Morgan says she expects cases to continue to rise this summer before coming back with another wave this fall and winter, and that people should consider getting their vaccines in the next few weeks.
And now we have schools open, that children then will bring it home and we'll start to see it in families, and we can probably expect an uptick the same as we've seen in previous seasons.
The new COVID-19 vaccine, which targets the latest strain of the virus known as KP2, is expected to be distributed in the coming weeks. However, Morgan says if that vaccine isn't available to you in time, a prior vaccine would still be effective in offering protection.
These are all sort of grandchildren and great-grandchildren and great-great-grandchildren of each other.
In Atlanta, Brittany Kleinpeter, 11 Alive News.
So the CDC is also reporting an uptick in the respiratory illness parvovirus B19, also known as fifth disease. Infections dropped during the COVID pandemic because all of the precautions that were taken, but that led to a reduction in immunity. So now more people are getting sick from this virus. Some people never develop symptoms, and those who do get typical flu-like symptoms followed by a rash and joint pain. The seasonal virus can also cause complications in pregnant women and those with sickle cell disease. So to stop the spread, doctors advise frequent hand washing and keeping surfaces clean.